I am Dr. Venkataramana, neurosurgeon, Brains Super Speciality Hospital. Recently we have heard about a situation which is rather unusual, but it is possible that a lady developing a stroke in the parlour due to an abnormal position for a longer period of time. It is very important to understand that the brain has 4 blood vessels. 2 of them are in the front, 2 of them are in the back. Now the back vessels, sometimes they go through the bony canal, and any kind of a problem either with the neck, the spondylosis, or the atlantoaxial dislocation, or a malalignment of the bones sometimes can compress these blood vessels when there is an abnormal position. Now normally either a full bending backwards or fully bending forwards can kink these blood vessels because it goes through a canal in the blood bone. Now 2-3 problems can happen in the parlour. Number one, when they tie a towel tightly, a person can develop a syncope. So it's very important then when you put a towel and tie it around the neck, it should be little loose, not very tight, particularly in elderly individuals. Now second thing, when they suddenly bend the neck down, if there is any loose joints at the neck, it will produce a shock like pain that goes all the way down. We call it as a Lermit's symptom. This shock like thing that going down whenever you bend suddenly the neck indicates that there is a abnormal movement of the cervical spine that can cause sometimes pain, weakness, and sometimes paralysis of the limbs. So we need to be aware of whenever such a symptom comes, you have to inform the doctor. Third thing, whenever the barber presses down the neck suddenly, if you get any pain or a shooting pain or a shock like pain, that also has to be reported immediately. Now an abnormal position for a long time can kink the blood vessel. I think when the blood vessel is kinked for a long time, 2 things can happen. Either it can get occluded because of the bone overriding one over the other, or if there is a clot inside the blood vessel that can get released and can produce a stroke. So these are the risks of this moving of the neck into an abnormal position. Unless somebody is doing a regular neck exercises, maintaining the neck position and the muscles properly, these accidents can happen because of the abnormal position without realization. So one thing is that try avoid abnormal extreme movements of the neck if you are not used to. Even if it is there, it should be for a short while. That's number 1. Number 2, regular exercise of the neck will build the neck muscles and can avoid such problems. And third, violent movement of the neck has to be always prohibited. Fourth, when you sleep, use a proper size pillow. As you age, the elasticity of the ligaments will come down and neck needs support, and you must use a pillow. There is a common myth saying that cervical spondylosis, neck pain, remove the pillow and sleep. That is wrong. Actually, you will be submitting the neck to the abnormal positions when you lie down to a side position. Neck will bend to all kinds of angles, and you will bring the hand to support that. Instead, use a proper thick, higher, proper pillow so that it will support the neck and it will take care of your neck.